have a guest this morning I'm very excited about. She's from Greece, and she's going to talk a little bit about some of the challenges and some of the successes that she's had in promoting social media and in e-marketing. Just to tell you a little bit about her, Emanuela is someone who's been in basically in the healthcare marketing ever since her first working position in 2004, and in a medical marketing agency, and it's called Medical Promotion. Her position there involves providing marketing services to healthcare units and private-owned medical and dental practices in Greece. Welcome, Amanda. Why don't you tell me a little bit more about what you do and how you started getting involved in using some of the online e-marketing tools?
Well, I'm speaking on behalf of Medical Promotion. It's a company that is based in Athens, Greece, and is actually a full-service marketing company that serves healthcare organizations of all sizes, including individual medical and dental practices, pharmacies, pharmaceutical companies, hospitals, and all other kinds of healthcare organizations. What we actually do is that we provide solutions that their main aim is to enhance our clients' reputation, and we do that by leveraging all kinds of marketing tools, from simple branding and printed materials to newspaper, magazine, TV show ads, and everything that is related to internet marketing, from simple website design to sophisticated SEO and social media marketing. All the services that I mentioned before, actually it was very challenging when we first introduced them at the healthcare sector in 2004, for the first time, I would say, in Greece. Everything was unknown to the healthcare industry here, and especially to the individual practitioners. That was due either to the legislative restrictions. I think you have in USA something, you had something similar with HIPAA, if I'm correct.
Yeah.
So problem about the existing social inhibitions and about the existing way the professionals were connecting with individual patients, or the way healthcare organizations, hospitals or medical centers promoted their services to the public.
What are some of the programs that you've implemented that you've seen great success from, and how did you leverage that?
Well, that is something too complicated to give you a simple answer. We manage is that we have until now educated healthcare professionals, especially the individual practices, on how to run their practices. And the most difficult thing in all that was that we had to make them differentiate the different the various aspects of their practice. You see, here in Greece, you may find a healthcare professional, I mean a doctor or a surgeon, holding both managerial, marketing, and even the scientific position in either his or her practice, or even in hospital organizations themselves.
Wow.
So it was so it was extremely difficult to differentiate all these different aspects of a practice, and learn them that, okay, if you acquire marketing services, that doesn't make you a bad doctor, or that doesn't make you a bad professional, or that doesn't show that your hospital is of lower level. I don't know if you get what I mean.
No, I totally understand. They were doing dual jobs, which in their case they felt they would be not providing the right type of service if they weren't involved in both.
Yes, that's right. And it was very peculiar to them to even introduce something different and tell them that you are not the person to do everything. You are not the person for all kinds of jobs inside your practice. And I have to say and admit that still now we haven't managed to cope with that successfully 100%. What we have managed is to tell them that they need something more in order to get acquainted and get some patients into their practice beyond being a good scientist and having a good academic background.
Mm-hmm.
So. Is that in 2004, when we first started, is that we had to take the law and all the professional ethics and translate them in a very careful way. So what we started doing is taking advantage of disease awareness and patient information material and transforming them into tools that could promote either the healthcare organization itself or the practitioner, the same practitioner. And that was difficult at first. What we did was really, restricted. They had an opening though in internet, and that is still now. They say that we can do whatever we want in internet with two only exceptions and taking two things in account, that we either educate the patient and the public, but at no case we are provocative, or at no case we do not advertise the professional or the hospital that is related to the website, to the social network account, etc. So our main aim through internet is to educate patients. Of course, into that we have added several other things that could assist us in making successful marketing campaigns, especially in the internet.
Wow, it sounds like you're dealing with some things like we are. We've got the HIPAA regulation, which makes it difficult for sharing information, or if you have an online community, if the patient starts talking about their particular information, it really is up to them. But unfortunately, if a healthcare professional interacts with them, it could cause them to be penalized. So there's things that keeps it, and then advertising becomes an issue because the information being used to advertise for that is also can be questionable. What do you think is the big thing for healthcare to learn in engaging in social media and digital marketing efforts? Do you think that there is something like video or using some of the other tools that could possibly help them in engaging their patients where they won't have to be concerned about these regulatory issues?
Actually, taking into account what you said before, what you just said about blogs and forums and all that, I have to mention a peculiar thing that happened about, and give you the answer through that.
Okay.
About 3 years ago, we had a campaign that we wanted to promote internet services and e-marketing and online articles, social media, etc., to a given specialty, IVF centers and gynecologist professionals. So we had the following peculiar event. We went to all the practices, and especially IVF, and introduced internet, and we told them about all the things they could do with internet, even acquiring patients from abroad, about medical tourism, etc. And they said that, oh my God, all these things are beyond us. They are, not illegal, but against professional ethics. Well, 6 months later, a gynecologist and one of the most reputable IVF centers right now in Greece and in Eastern Europe acquired our techniques, and 6 months later they became one of the most well-known IVF centers here in Greece.
Wow.
Because people were talking about it freely in blogs. They said their experience, and they gave out either secrets or, how to say it, success rates of either the professional on its own or of the different procedures that he applied, or even of the collaborations he had abroad. And what we saw is that all the IVF society of the Greek professionals here in Greece were talking about that. So everyone started saying, oh my God, what did they do? And we want to do that. And we're going to copy that. So right now, you may not find any IVF or OB-GYN practice not having a website and not having a social media account. But the only disadvantage of all that is that they don't know how to use it. So what we did is trying to educate them and make them have social media accounts or apply internet techniques that really have a result. For instance, Facebook professional pages were something unknown to them. They thought that by just making an account in Facebook or in Twitter, they could acquire all the great results of e-marketing or of social media marketing.
Right, right.
I don't know if, you see how things work here. They're really peculiar.
I want to add, too, to our audience that you also have a degree in biomedical sciences and molecular medicine from Imperial College, so you understand the sciences and get the drift of what they're doing. So being able to understand that and then helping them promote would make sense that you would have that opportunity to at least leverage your knowledge base with them and get them to see the other side. And I know it's got to be difficult. We have the same issue here. They don't get the full gist of what social media or e-marketing is and how to best leverage it, or if they do, they're not quite sure how to go about it.
Yes, actually you are really right about that, and thank you for mentioning it. Actually my science degrees gave me the opportunity to get a talk with all the professionals and make them believe, quoted believe, of what I'm saying, and giving them real examples of how any social media application could be integrated into different specialties, and how that could help them in promoting their practice and gaining from that. Actually, I think that these degrees are the ones that gave me the opportunity to approach them and make all that education of the professionals and of our services succeed. Otherwise, I don't think if I had the capability to promote all that.
It sometimes takes that talking almost peer-to-peer. So tell us a little bit about the health reform you were talking about to me online that's going on in Greece right now, and why you think social media and digital marketing will help in those different sectors.
Simple words, health reform situation in Greece aims at both regulating and reducing insurance and public healthcare economic chaos that exists right now in Greece. So, in order each public healthcare organization to live up to this expectation, it has to follow a particular way and behave in, let's say, like a private profit-driven organization.